And we're back with Dr. Sherman Leis from the Philadelphia Center for Transgender Surgery. Thank you again, Dr. Leis, for joining us tonight. We're going to stay on with you for a few more minutes, but I know you'll be back with us again at some point, and we look forward to you being a recurring guest on PETV. So thank you for being with us tonight, and we look forward to seeing you again. A couple more questions. There was a question asked in our chat room by Darla, who asked, addressing the M2F issues of natural vaginal lubrication, is there any reason not to use grafts or donated grafts instead of bowel resections? Can you address that real fast about how you deal with grafts, or grafts are a possibility?
We usually don't do grafts because we have enough skin from the penis and the scrotum to line your new vagina, so we don't need grafts. And we certainly would never use a donated graft from anyone else because it wouldn't take. Sometimes we take skin from other people and use them for burn. We take from cadavers, for example, and use them as temporary grafts in burn patients, but they're only for a few days, and they fall off. They don't take. In order to get a graft to take from one person to another, you have to do what they do with heart transplants. You have to put people on anti-rejection drugs, which are not only very expensive, but they're dangerous too. If you get a cold, you wind up with pneumonia because it kills your autoimmune system. So we certainly wouldn't use techniques like that instead of the techniques that we're using, which is your own tissues. We use all your own tissues when we do a vaginoplasty. I don't like the colon to use as a vagina, as a neo-vagina. The colon, number one, means that we have to transect your intestinal tract. We have to go into your abdomen and do a bowel resection, which has a lot of risk to it. You can get peritonitis, the bowel, then you have to anastomose the bowels again. And that can break down and leak and cause all kinds of potential serious life-threatening problems. So there's no reason to do it for that. And also, it's not a good vagina to have, because colon vaginoplasties are famous for excess lubrication. That supposedly is the benefit, but the truth is that you lubricate continuously. You're dripping and dripping all the time. You have to wear pads and gauze and diapers and Depends and all that stuff. It's a mess, and we just wouldn't use it because there are better techniques. I use that as a salvage procedure. If someone's already had 2 or 3 different types of vaginoplasties and for some reason they've all failed, then you might use the colon interposition procedure vaginoplasty as a last resort, but don't think of that as a good primary surgery as the first technique you would use. So the final answer is, of course, your new vagina is lined with skin. It's the skin from your scrotum and the external skin of your penis. So you have to lubricate. You always have to use a personal lubricant, and they work fine. Millions of people use the personal lubricants. You don't have to be a trans person to use them. Every drugstore's got probably 20, 30, 40, 50 personal lubricants that people are yanking off the shelves because a lot of people use them.
They do.
So that's the thing to do.
And follow my advice. Too much lube is usually not enough. Is almost enough. Any other topics you would like to talk about tonight? Anything you'd like to give us some advice on, or bring us up to date on, or I don't know, anything. Give me a break.
Are you talking to me?
Yeah, I'm talking to you.
Well, there are all kinds of things we can talk, and we can devote another show to just facial feminization procedures, and another one to breast augmentation procedures or breast reduction, and another one to M to F bottom surgery or F to M bottom surgery. There are a lot of questions that come up, so we can talk for a long time about almost any of these things.
I think we have a call. Can you hear me? Is you there?
I'm here.
I think we have Chloe Princess on the phone. Hi, Chloe.
Hi, Kristy. Hi, doctor.
Hi, Chloe. How are you?
I'm doing fine. I have a question for you, and it goes kind of back to the silicone thing.
Sure.
My question is I've seen a couple different ways to plump up your upper lip, and one of them is, of course, injecting silicone into your lips, but isn't there also a strip or a skin method which they can pull through your lip?
Yes, I don't like those methods. They're very unreliable because you never know how that skin, that piece of dermis from your own body, or from a cadaver's body, how it's going to last. Usually they last, but they can be lumpy. And also, dermis grafts, which are really a very old technique. They've been around for 40, 50 years already. Because the dermis of the skin contains what we call adnexa, specialized glands, sweat glands, hair follicles, sebaceous glands. Those glands can grow after they're transplanted, so you can wind up with lumps and bumps and cysts or hairs filling up your lips. So most surgeons don't like to use those dermis grafts. We used alloderm for a while. That can be used, and it becomes vascularized by your own blood vessels. It's a human dermis graft. It's very expensive. We used to use Gore-Tex. We used to put in the lip years ago, and that was turned out to be a disaster in many cases because it would get hard and lumpy. It's a foreign material, synthetic material, Gore-Tex. It's used in clothing. It still is used in the form of some sutures or in hernia repairs and sheets, but it's not been good for lips or for nasolabial folds because they can sometimes get very hard, and we had to take many of them out. I think the best way to augment lips is not silicone, by the way, because if you inject more than a minuscule, remember we talked a little while ago about micro droplets, 0.01 or 0.02 of a cc, that's a very tiny amount. It's not enough to augment your lip very much. And also, if you inject more, you can easily get lumps in your lip or granulomas. These granulomas are inflammatory tumors, which you don't want to have in your lip. My favorite way to augment lips is using injectable fillers. Now, you can only use certain fillers because some fillers, for instance, like Radius, can get lumpy. Artifill's a new filler that's permanent, but it might also get lumpy, so it's not recommended to use that. My favorite filler right now, the best thing I think on the market right now is Juvederm. Juvederm lasts for 6 months to a year. You come in and do it maybe once every 6 months, 4 months, 6 months, 8 months. You put it right underneath the skin. You put a little bit of it right along the vermilion of the lip, upper lip, lower lip, or if we want, we can just do the edge of the lip. That's called the Paris lip, only because it was first done in Paris. And it gives a very nice result. We put it in and we massage the lip a little bit, smooth it out. You can mold it pretty well during the first 1 or 2 days after the procedure, and it gives really beautiful results. My office manager gets it done every once in a while, and she's very happy with it. And we do that frequently. It gives a very nice result. I can mention, as long as we're talking about lips, one of the facial feminization procedures that we do is upper lip shortening, because a lot of male lips are very long, and women in general have a shorter lip. There's less height to the lip. The distance between the bottom of the nose and the edge of the lip, the pink vermilion, is shorter in many women, and it's a sign of femininity to have a shorter, more delicate lip. And when we shorten the lip, I take out a triple crescent of skin just under the nose, so it hides right in the creases of the nose. I've seen some patients come in that have been done out by other doctors. They just have a straight line right across the middle of their lip. It looks terrible, but it should be done so that the incision lies right in the edge of the alar base, the base of the edge of the nose, under what we call the nostril sill, another little crescent under what we call the columella of the nose, and another crescent under the nostril sill and around the base of the ala. Then we take another incision, another triple crescent, maybe 1/8 of an inch or 1/4 of an inch below that. Remove that entire skin, elevate the skin on the central part of the lip, move it all up and suture it carefully in place. That gives a nice lip. Also, the philtrum of the lip, this central portion of the lip that we call the philtrum column, the philtrum complex, it has 2 little columns, a dimple in the middle called the philtrum dimple, and a little heart-shaped area that we call Cupid's bow. If someone doesn't have a well-defined philtrum complex, I can create it when we're doing upper lip shortening by reconstructing those columns and the dimple. So that's a nice thing to have a shorter lip. And when we do that, and the point of this whole paragraph is that when you shorten the lip, it everts the vermilion of the lip. It everts the red portion of the lip, and it shows more lip. It also shows a little bit more teeth. So when you're talking or just resting, you show a little bit more teeth, which is more feminine. The shorter lip is more feminine. The delicate philtrum complex is more feminine. The more vermilion is more feminine. And we do that, we can do that, and then you don't have to augment the lip by any injectables, because that does give a fuller, younger looking, more pouty lip.
I had that done with the incision under the nose, and it's been 15 months now, and that incision is still, I'm not happy with that scar.
If I ever see you, I'll take a look at it. It should be pretty, it's always there, but it should be very, very difficult to see in about a year after surgery. All scars should be pink in the beginning, but as the months go by, somewhere between 6 months and a year, the first few months you put a little makeup on, but between 6 months and a year, my patients usually just have a very fine white line that's very difficult to see. And it's hiding in the shadows of your nose. Yeah. So you really shouldn't be able to see it very much.
Are you still with us, Chloe?
Yeah, I am. And I have one other question towards the silicone. Is some people, I know some people that have done silicone pumping into their body and they had tragic results and they just live with it. And they're both embarrassed to talk about it. They don't know what to do. Some people don't have the money to do anything about it. Is there any options for them?
Well, I mentioned before that if they have any kind of insurance at all, insurance usually covers surgery for removal of a foreign body granuloma. So insurance should give them some basic coverage for that. Yeah, I just hope people hear this. I mean, a number of people have died. Miss Argentina, Solange Magnano, died when she was 38 years old from pulmonary emboli from silicone, a couple of days after she had a silicone. A girl by the name of Kelly here in Philadelphia, who was a pumper at these pumping parties, went to Mexico to get a big lump removed, and she died having the surgery to remove a big silicone lump. So it's very, very dangerous. Priscilla Presley had silicone injected into her face, and, yes. And she didn't realize it at the time, but she had industrial grade silicone, which was contaminated with automobile lubricant, injected into her body. I don't know what kind of headache she has now.
Well, I've heard and read stories about people going to Thailand, going to some of these discount overnight doctors over there and other places. Not that all doctors, are like this, but there are those that exist where they do FFS instead of, when they shave the brow bone and they do different contouring. But sometimes they have ridges and they just put silicone in there to smooth it out, and then in about a year or two, it degrades, and then there's all these crevices and so forth in their foreheads.
Thank you, Chloe.
Good night, Chloe.
I have no idea how many calls I've missed tonight. You have called tonight, girls, and I have not gotten to you. I think Chloe tried calling at least 3 times. I apologize for that. Dr. Sherman Leis, thank you so much for joining us tonight. I look forward to the next time you're on with us, and let's make it again soon, okay?
Super. It was a lot of fun. Thanks for having me.
Thank you very much.